we will discuss how doctors use the lab test to figure out the cause of high calcium levels in the blood, known as hypercalcemia.
Once the diagnosis is confirmed, the first step is to check if the parathyroid hormone is involved, since this hormone plays a key role in regulating calcium levels.
The initial test measures the amount of parathyroid hormone in the blood.
If this hormone is elevated, the hypercalcemia is likely due to overactive parathyroid glands, a condition called primary hyperparathyroidism. This is a common cause of high calcium and is especially seen in postmenopausal women or people with certain inherited conditions affecting the parathyroid glands. If parathyroid hormone levels are not elevated, the high calcium is likely caused by something else, such as cancer, vitamin D problems, or rare disorders. If parathyroid hormone levels are high or in the upper normal range, doctors usually consider primary hyperparathyroidism as the likely cause because parathyroid hormone should normally decrease when calcium levels are high. However, in some cases, an inherited condition called familial hypocalciuric hypercalcemia, a rare genetic disorder, might be responsible. To tell the difference, doctors measure the amount of calcium in the urine. High calcium in the urine suggests primary hyperparathyroidism, while low calcium in the urine points to the inherited condition.
When parathyroid hormone levels are low or in the lower normal range, it's unlikely that the parathyroid glands are causing the problem.
In this situation, doctors investigate other possible causes. Vitamin D levels. Vitamin D comes in two key forms. High levels of 25-hydroxyvitamin D, the storage form, usually mean the person has taken too much vitamin D. On the other hand, high levels of the active form, 1.25-dihydroxyvitamin D, can occur in conditions like certain cancers or diseases like sarcoidosis, where the body starts producing extra active vitamin D. Cancer-related causes. Certain cancers can produce substances that mimic the action of parathyroid hormone, causing calcium levels to rise. If a cancer is suspected, doctors might test for these substances to confirm the diagnosis. Other tests. When the cause is unclear, additional testing can help. For instance, blood tests can look for abnormal proteins associated with multiple myeloma, a type of blood cancer, or for excess thyroid hormone or vitamin A, which can also lead to high calcium. Imaging tests, such as chest X-rays, may identify signs of diseases like sarcoidosis or hidden cancers. If the active form of vitamin D is high but there are no obvious signs of cancer or sarcoidosis, doctors may search for less obvious causes, like small clusters of inflammation in organs such as the lungs or liver.
This step-by-step approach allows doctors to pinpoint the cause of hypercalcemia, which is essential for choosing the right treatment.